Hello, and welcome to the last topics for the semester. I wanted to include the topics of stress, mental health, and mental illness in our discussion simply because this is a problem in today's society. And especially with the lockdown that we're currently under, we are now very concerned about mental health in individuals who are being isolated because of the coronavirus. So, first of all, I want to say something. I want to preface this all by saying to you that this is a topic very close and personal to my heart. Several years ago, I was diagnosed with a mental health disorder. My form of mental health disorder is a chronic form of depression called dysthymia, which is just a low-level depression that occurs at all times, anxiety disorder, and PTSD. I would encourage you, if you have any questions at all, to feel free to contact me. I'm very open about my mental health uh, disability simply because this is something I didn't choose for myself, and certainly I think that we need to get rid of the stigma of mental illness. But first of all, let's talk a little bit about stress. Well, what is stress? And I like this word map simply because you can see so many different things that stress can be involved in. Certainly depression, panic attack, exhaustion, dysfunction, behavioral issues, anxiety and anxiousness, being overwhelmed, fear, pressure, sadness. There's so many different things that can be involved in stress. So the first question we need to ask ourselves is, what is stress? Stress is not the same for everyone, but here's a good definition of stress. It is any perceived or anticipated threat that disrupts a person's well-being or homeostasis. Have you ever felt like this person here, where you've just got thoughts that are going everywhere all the time and there doesn't seem to be any organization? Well, that's certainly stress. Stress can stem from physical incidents such as a dramatic temperature change, physical abuse, or some other form of physical trauma. Physiological stress, such as with infection or inflammation or other illness. And then certainly psychological stress, the fear, social rejection, feeling out of control in the situation that you are in. And studies have shown actually that all three of these actually have the same physical impact on the body as each other. And in fact, some studies have actually shown that the psychological stress actually can be worse sometimes than the physical and physiological stress that we see in the world. A person's experience or a person experiences stress when a demand exceeds the person's coping ability. If you are alive, you will exhibit or experience stress at some point in your life. Stress begins with a stimulus that the brain perceives as stressful and in turn promotes adaptational and survival related physiological responses. And it doesn't matter what the stimulus is, if the brain perceives it as stressful, then we get these physiological responses. So, stresses have to equal our coping skills in order for us to stay in balance. However, these responses can become dysregulated, and this will actually cause then the pathophysiology. Little historical information. Walter B. Cannon was an American physiologist and a professor and chairman of the Department of Physiology at Harvard Medical School. He was the first that coined the term fight or flight response in naming the sympathetic response that we see during stressful situations. Hans Selye is known as the father of stress research. He actually showed the physiological stress involved: enlargement of the adrenal gland, decrease in lymphocyte levels, development of bleeding ulcers, and he concluded that physiological stress impairs the ability to resist further stresses. In other words, the more stressed you are, any other stress can trigger even further problems. And Hansiles actually came up with this general response known as the General Adaptation Syndrome or GAS. He perceived it primarily as physiological. Again, didn't matter what the stimulus was, but this is what he said, was that the body reacts in three phases to a stressor. In the first phase, the alarm stage, the body mobilizes to confront the threat, and this can actually temporarily expend resources and lower the resistance, but then will come back with the sympathetic nervous response. In the resistance phase, the body is actively confronting the threat, and resistance remains fairly high, at least for a period of time. However, if the threat continues and is not resolved, the body actually will move into the exhaustion phase, and you can see right here that the line will then drop below the level of normal resistance, and this is when we can get into physiological problems. This slide's a very, very busy slide, but let me just go through a few things here. First of all, the stressor, whatever it is, will affect the central nervous system. The brain perceives it as a stress. This will trigger electrical impulses to the hypothalamus, where we will release corticotrophin-releasing hormone. Corticotrophic-releasing hormone will go to the anterior pituitary to release ACTH, the adrenocorticotrophic hormone. This will then go through the blood to the adrenal cortex, where we release massive amounts of cortisol or cortisone. It also, corticotrophin-releasing hormone, will activate the posterior pituitary to release ADH or vasopressin, and this will actually increase water retention within the body. Stressors can directly affect the sympathetic nervous response, and this will happen with the adrenal medulla. The chromaffin cells of the adrenal medulla will release epinephrine and norepinephrine, and these two will actually have a number of effects. Epinephrine is really what's going to cause that sympathetic nervous response. We're going to see bronchodilation, so respiratory rate will increase. We'll see increased force and rate of cardiac contraction, so we have increased cardiac output and increased heart rate. We'll see decreased glycogen synthesis and increased glycogenolysis. That basically will cause increased blood glucose, because we need that blood glucose going to the muscles because we are in that fight or flight mode. Norepinephrine will increase blood pressure, increase pupil dilation, so the eyes get really big. It will cause piloerection or the goosebump effect. And norepinephrine also will activate something called neuropeptide Y, which is a vasoconstrictor in certain areas, and this basically helps to redirect the blood from areas that are considered not necessary at the moment, such as the digestive system and even the high brain function, to the muscles. So we get more blood flow to those skeletal muscles because, again, we're in that fight or flight mode. Cortisone's main effects are going to be to increase glucose production, either through breakdown of fat, and the other thing that will happen is that we have an anti-inflammatory or pro-inflammatory response depending upon where the cortisone is affecting. But overall, cortisone or cortisol has an immunosuppressive effect overall. So we'll talk a little bit about each one of these altogether. So how does stress affect the body? Well, because we actually see blood flow redirected to the skeletal muscles, the hindbrain, the cortex, actually will have a decreased blood flow. So people oftentimes will have difficulty in concentration. They'll have anxiety, depression, irritability, mood dysfunction, and mind fog. Think about this. Have you ever taken an exam and you go, I know the answer to this question. I know the answer to this question. You can't think of it, can't think of it, can't think of it. And 5 minutes after you leave the room, you actually think of it. That's because you were in that stress response and the brain was not receiving enough blood to retrieve memories. In the cardiovascular system, we'll see higher cholesterol levels, higher blood pressure increase, and this will increase risk of heart attack or stroke. In the joints and muscles, we'll see increased inflammation, more tension in the muscles, see more aches and pains and muscle tightness, and again, part of this is getting ready for that fight or flight. The immune system overall will become depressed. In the skin, we'll see hair loss, dull or brittle hair, brittle nails, dry skin, acne can occur, and delayed tissue repair. Primarily, the delayed tissue repair is due to, again, cortisone. In the digestive system, we'll see nutrient absorption being affected, usually decreased or abnormal absorption. This can cause diarrhea and or constipation, indigestion, bloating, pain, discomfort. And this is an interesting thing. In the reproductive system, actually we see decreased levels of especially testosterone, and so we see a decrease in the libido and increases in the premenstrual syndrome symptoms in females. So what is the link between stress and illness? I have put a video under the modules in the narrated PowerPoint on how to make stress your friend. This is a TED Talk by a lady who really focuses on not so much decreasing stress, but how can we cope better with the stressors that occur in life. And this actually is a good one for you to watch. It's about 15 minutes, so I would encourage you to watch her talk. But there is evidence that implicates stress as a precipitating factor for some diseases and conditions and worsening symptoms and outcomes in others. And here's just a small list: atherosclerosis, irritable bowel syndrome, ulcers, asthma, autoimmune diseases, certainly anxiety, delayed wound healing, chronic pain and fatigue syndromes, reproductive dysfunctions, diabetes, depression, and even HIV. So let's look a little closer at some of the hormones involved here. So neuroendocrine regulation. The catecholamines, epinephrine, norepinephrine. These are released from a group of cells called the chromaffin cells in the adrenal medulla under direct stress effects. It mimics direct sympathetic stimulation and is part of the sympathetic stimulation. Both epinephrine and norepinephrine increase pro-inflammatory cytokine productions. Cortisone or hydrocortisone or cortisol, all the same thing, have effects throughout the body. It's activated by the adrenocorticotrophic hormone released from the anterior pituitary gland under the influence of the hypothalamus. It's secreted during stress. It reaches all tissues of the body. It will stimulate gluconeogenesis, in other words, increasing blood glucose levels. It elevates the blood glucose, and it's a powerful anti-inflammatory and immunosuppressive agent. So, cortisone increases blood glucose sugar, primarily to make sure that our muscles are going to run. It will heighten memory and attention, but memory recall may actually be depressed. Increases blood pressure, decreases sensitivity to pain. It will suppress the immune system and decrease serotonin release in the central nervous system. Abnormal elevations of cortisol have been linked to obesity, sleep deprivation and sleep disorders, lipid abnormalities, hypertension, diabetes, both type 1 and type 2, atherosclerosis, and loss of bone density. Secretion during stress inhibits the initial inflammatory effects. It delays resolution and repair of tissues, so slows down the healing response. It's shown to induce T-cell apoptosis. It influences virtually all immune cells. and elevated levels over long periods of time decrease the innate immune response and increases autoimmune responses. Cortisone can be used therapeutically as its powerful anti-inflammatory immunosuppressive effects are very good if we're trying to decrease this response, especially in hypersensitivity reactions. Beta endorphins, may not have heard a lot about these, but these are important neuropeptides found in the brain that have intense pain relieving capabilities. They are released in response to stressors and decrease the transmission and perception of pain in the high brain centers. Inflamed tissues activate endorphin receptors. Hemorrhage actually will increase levels, which inhibits blood pressure increases and will delay compensatory changes so that blood pressure remains normal even in the face of severe hemorrhage, such as losing almost half of your blood volume. Growth hormone. Growth hormone affects all of the cells of the body. It's produced by the anterior pituitary and by certain lymphocytes and mononuclear phagocytic cells such as neutrophils in small amounts. Normally affects proteins, lipids, and carbohydrate metabolism. It will counter the effects of insulin in many of the tissues. But chronic stress slowly decreases growth hormone over time. Prolactin. Prolactin released from the anterior pituitary is normally necessary for lactation and breast development in the female. But prolactin levels in the plasma actually increase as a result of stressful stimuli. This may be due to the fact that the next hormone I'm going to talk about is actually a very important one in stress, and that is oxytocin. Oxytocin has often been termed the hug hormone. Oxytocin is produced by the hypothalamus, stored in the posterior pituitary, and released during childbirth and lactation. Oxytocin affects smooth muscles in the endometrium of the uterus for labor and delivery, and affects smooth muscle in the lentiferous ducts to allow for milk letdown during nursing. Oxytocin, however, has been shown to be produced during orgasm in both sexes and probably produces or promotes the release of anxiety. Oxytocin, being known as the hug hormone, actually is released in small amounts when we have social contact. This actually will reduce anxiety and make you feel better. And so right now, during this time of social distancing, I wonder about the fact that are we getting enough oxytocin? And as the speaker on the TED Talk says, maybe we should just be snorting this stuff. Testosterone regulating the male's secondary sex characteristics and libido in both sexes, we actually see will decrease during stressful stimuli, and this will exhibit immunosuppressive activity. So oftentimes in couples that are trying to become pregnant, because of the stress, we actually will see a decrease in the libido in both male and female, and we can actually see a decrease in the sperm count in the males. Estrogen seems to exert a calming effect during stressful situations. Melatonin, involved in our sleep response, actually increases during stress, and this may be one reason why oftentimes during those stressful situations we just simply want to go to bed and sleep. Now, stress itself is not an independent entity, but it's a system of interdependent processes. As I showed you on the slide with just epinephrine, norepinephrine, and cortisol, there's so many different things that are going on at the same time. It is a highly individualized response. What might stress you out may not stress me at all. And so it's how we perceive the stressors in our lives that make this highly individualized. Personality characteristics also are associated with individual differences in the appraisal and response to stressors. How is it that emergency personnel can just automatically do many of the things they do during their stressful situations, and then secondarily have the effects after the crisis is over? Well, this is because, again, they've been trained and that personality comes through during that time of emergency. Adverse consequences of stress can be minimized by learning adaptive coping mechanisms. High perception of stress is associated with reduced cytotoxic T cell effects and actually cytotoxic T cell apoptosis. And so again, we can reduce the immune response by being stressed. So how do we cope with stress? Well, it will either be adaptive or maladaptive. Strategies beneficial when problems are focused and when social support is sought. The old saying is that when you have social support, your troubles are halved. Maladaptive coping abilities may contribute to the overall adverse health effects. So it's not necessarily the stress that's killing you, but it's how you're coping with the stress. And I love this picture. I'm so stressed out over being stressed out that I can't even remember why I'm stressed out, and it's stressing me out. Certainly, I'll share with you, last week was a difficult week. Because of the situation going on in our world right now, this has been a very difficult time. It seems like my world has shrunk to 4 rooms, the kitchen, the living room, the bathroom, and the bedroom. And it's very difficult sometimes to not have that social interaction. All right, so let's turn our attention to what is mental health and mental illness. Mental health encompasses our emotional, psychological, and social well-being. And I chose these figures from the movie Inside Out. If you've never watched this cartoon, it's actually a very nice little cartoon, and it has a lot of underlying deep meanings. And really, the whole point of the movie is that you need all of these emotions to be psychologically normal. Mental health affects how we think, how we feel, and how we act. Now, what is mental illness? It is a health condition, and let me stress that. It is a health condition. It is not something anyone chooses. It is oftentimes due to an abnormality in the brain chemistry or in some other chemical abnormality found in the body. Mental illness involves changes in our emotions, our thinking, or our behavior, or really a combination of all of these. It is often associated with distress, and so again, not able to cope with stressors, and or problems functioning in work, social, or family settings. What are some of the common mental illnesses that we see? Probably one of the largest one are the anxiety disorders. This is a group of mental disorders characterized by significant feelings of anxiety and fear in situations that typically would not uh, induce these feelings. The amygdala may actually play a role in this, and the hippocampus. Both of these areas are involved in our emotional expression. So some examples: panic disorders, phobias, social anxiety disorder. Personality disorders. These are maladaptive patterns of behaviors causing long-term difficulty functioning in society. So some examples: borderline personality disorder or dissociative identity. Personality disorders tend to become an integral part of the person and therefore are very difficult to treat or, quote, cure. Psychotic disorders. These are severe disorders that cause abnormal thinking and perceptions, and probably the best example of this is schizophrenia. Eating disorders. This includes both anorexia and bulimia, and it's a range of psychological disorders that are characterized by abnormal or disturbed eating habits. Estimated 20 million women and 10 million men in America will have an eating disorder at some point in their lives. And this would also include binging and purging. Substance use disorders, and this can be alcohol, drug abuse, uh, even sometimes what we call just addictive personalities. But a condition in which the use of one or more substances leads to clinically significant impairment or distress. And then mood disorders, characterized by severe changes of the person's mood, sometimes within a very short period of time. So we can go from being really, really happy to really, really sad within a very short period of time. Depression, and depression covers a huge number of disorders. And bipolar. Now, my depression, dysthymia, is a low-level chronic depression. It means basically I'm depressed all the time. However, I have good days and I have bad days. Bipolar disorders tend to be where you have manic days, so you're really, really, really high, and then you go in depressive days. And these can be really, really, really low depressive times. And sometimes in bipolar disorders, you actually can see a person going from the manic stage to the depressive stage within just a matter of sometimes minutes. So, mental illness is extremely common. However, it has that stigma associated with it. And so we need to get through that stigma to understand that this is an extremely common disorder. In a given year, nearly 1 in 5, almost 20% of adults in the United States will experience some form of mental illness. 1 in 24 adults have a serious mental illness. This would include a major depressive disorder, schizophrenia, or bipolar disorder. 1 in 12 will have a diagnosable substance abuse disorder. Here's the good news. Mental illness is treatable. The vast majority of individuals with mental illness continue to function in their daily lives. Mental illness is nothing to be ashamed of. It is a medical problem just like heart disease, cancer, or diabetes. In my form of depression, I actually function with the help of medications, and that's all right because it allows me to function and to have a better outlook on life. And mine is actually caused by a brain chemistry imbalance where I do not recognize serotonin levels. I produce serotonin, but that never gets to the serotonin receptors. And so therefore, I have a problem with my serotonin being low in function. I actually put another video in your narrated PowerPoints called What People with Depression Want You to Know. And it's a very interesting one, and I would have played it for you in the class and made some comments, but I'd really like for you to watch this as well. And I like this. Being depressed doesn't mean I'm suicidal, dangerous, or a drug addict. It just means I'm depressed. So is it depression or is it just sadness? Sadness is a normal human emotion. Everyone experiences sadness at times. It's usually triggered by a difficult, hurtful, challenging, or disappointing event. We tend to feel sad about something. We have a loved one that dies. We're sad. We don't get something that we want in life. We're sad. When the situation resolves or our emotional feeling fades, the sadness goes away. Depression, however, is an abnormal emotional state. It's a mental health illness that affects the individual's thinking, emotions, perceptions, and behaviors in extensive and oftentimes chronic ways. Depression saps energy, motivation, and the ability to experience other emotions such as joy, excitement, satisfaction, connection, and/or meaning. It makes most people impatient, quicker to become angry or frustrated, quicker to break down, and tend to take much longer to bounce back from anything. How many times have we asked someone or been asked ourselves, "How are you?" And we say, "Fine." What's in that word? Well, there can actually be a lot of things in that word. Never feeling good enough, feeling anxious, I'm falling apart and you don't even notice it. Panic, rejected, lonely, defeated, confused. All of those can actually be in that word. I also like this picture. I like the fact that this is what sad looks like. And I get it. This is what sad looks like. But this is what depressed looks like. We can put on that smiling face, and yet behind that mask, we see this, but the world will see this. And I love this quote from Robin Williams. Are you okay? All it takes is a beautiful fake smile to hide an injured soul, and they will never notice how broken you really are. I have this up in my office, and every day I look at it and I realize, today do I put that mask on or do I let the world see the real me? Now, what are some symptoms of depression? Well, to be diagnosed with one of the forms of depression, a patient needs to have at least 5 of the following symptoms for a minimum of at least 2 weeks. The severity must also be considered, so please use these as a guideline. A depressed or irritable mood the majority of the time, like a little cloud hanging over you all the time. A loss or decrease of pleasure or interest in most activities, even those ones that the person has liked. Significant changes in weight and or appetite. This can be either increase or decrease. Disturbances in falling asleep, staying asleep, or sleeping excessively. A feeling of being slowed down in one's movements or feeling restless most days. Right now, during this lockdown, the restlessness has really become part of my world, and I'm trying to do things to cope with it. Feeling tired, sluggish, or having low energy most days. And that's hard when you're facing some of the coping mechanisms. Having feelings of excessive guilt or worthlessness on most days. Having problems with thinking, focusing, being creative, concentration, or decisions making most days. And having thoughts of self-harm, dying, or suicide. Anxiety is characterized by a sense of doubt and vulnerability about future events. Now, anxiety can be a single entity, but oftentimes it does go with depression. Anxious individuals focus on their future prospects and fear that those will be bad. So again, another one of these word maps. And if you compare anxiety to the stress word map, you'll actually find that there are several of the same things that are in here. And so, does it kind of go together? Absolutely. So what are some signs of anxiety? And this list is not an inclusive list, but here's a few. Variations in heart activity, either faster, slower, skipping beats, or being louder, or being perceived as being louder. Feeling lightheaded and or dizzy. Labored or impaired breathing, even without exertion. Pain and or a heaviness in the chest. Sometimes anxiety or panic disorder has actually been misdiagnosed as having a heart attack. Numbness and or tingling in the toes, the fingers, and or scalp. Sweating. Blushing in the face. Feeling weak. Having the urge to run. This is a sympathetic response. trembling of the body, voice cracking or trembling, various pains, back pain, headache, joint pain, having an upset stomach or an upset GI system altogether, an urge to urinate or have a bowel movement, feeling hyper, feeling of head expansion or contraction, visual disturbances including double vision or feeling of dizziness and having the vertigo feeling, feeling of unreality as if you are no longer inside your body. So, you ever felt like Charlie Brown here? My anxieties have anxieties. I really identified with poor Charlie Brown. But this sense of dread, the shakiness, feeling faint, wobbly legs, a rapid heartbeat, almost feeling like you're choking. I had my first anxiety attack when I was 13 years old, and I literally thought I was having a heart attack. So how can we live with depression and or anxiety? Well, first of all, you need to know you are not alone. And that's one of the reasons why I'm very open about my diagnoses is because, hey, it happens. So let's learn to live with it, deal with it, and help others with those issues. Many people live with depression and anxiety, and I love this cartoon. All these people really seem to have it together, and I still have no idea what's going on. That's why I said, if you all had questions in class, don't be afraid to ask, because if you had the question, there's probably 23 other people in the classroom that have the same question. So we're not alone in this. Recovering from depression requires action, but taking action when you're depressed is extremely hard, trust me. In fact, just thinking about the things you should do to feel better, like going for a walk, spending time with friends, can actually literally be exhausting. The key to depression recovery is to start with a few small goals and slowly build from there. Draw upon what resources you have. You may not have much energy, but you probably have just enough to take a short walk around the block or pick up the phone to call a loved one. I've actually thought about getting just a block of wood, putting it down in the floor of the living room, and walking around it a couple of times so I can say I've walked around the block twice. Taking things one day at a time and reward yourself for each accomplishment. The steps may seem small, but they'll quickly add up. And for all the energy you put into your depression recovery, you'll get back much more in return. I have to acknowledge, I did not want to do this presentation on a narrated PowerPoint. But I finally said, okay, I have to do this no matter what. And I'm going to feel a lot better when this is all said and done. So, taking the small steps. I've been down at step number 1 a lot of times. I won't do it. Okay. And then sometimes it's just, I can't do it. And then maybe I get to, I want to do it, but I won't do it. So, can you fall back down the steps? You can't. And is that okay? Absolutely. Sometimes I want to do it, but how do I do it? And that may take other people's input. I'll try to do it. I can't do it. Now I got to do this back again. I can do it. I will do it. Yes, I did it. And at the end of this, you're going to hear that. So how to live with depression? Can depression be completely cured? Certain forms of it probably can. However, there are some forms like mine that will not be cured. So I have to learn how to live with them. So here's some self-help tips. 1, cultivate supportive relationships. I don't have a lot of really, really close friends, but those that I do have, I keep very close. They understand when I'm having a really bad day, and they understand what they need to do in order to help me get through those really bad days. Depression self-help tip number 2, get moving. This one's hard for me, especially with all the aches and pains I have in joints and back issues. It's sometimes hard, but sometimes just getting up and taking a short walk is the best thing. Challenge negative thinking is number 3. We call this spiral down thinking. What if? Well, if that happens, what if this happens? What if this happens? So think about this. Oh no, I can't answer this question on the exam. Oh, I can't answer the next question. I'm not going to be able to pass this exam. I won't pass this class. I'll never get into my program. I'm just no good. We need to stop that spiral down thinking. The best time to stop it is right here. What if? So sometimes when I'm having something that I feel like starting to spiral down, I go, so what if something happened? And I imagine the worst case scenario. And oftentimes that's death. And what I think is, can I get through the worst case scenario? Well, if I'm dead, I won't have to, and that's great. But what's the next worst case scenario? If I can get through that, then I don't have to worry about all the rest of it. And it is very difficult sometimes to break this negative spiral down thinking. Number 4, do things that make you feel good. Sometimes that's hard. Sometimes there are things that you think will make you feel good and you're just not interested anymore. Sometimes that's a difficult thing. So sometimes you have to look for new things that may make you feel good. And number 5, eat a healthy, mood-boosting diet. This kind of helps with the get moving part as well. And so, that's kind of hard sometimes too. And let me just say this, sometimes it's okay to eat a nice greasy cheeseburger with bacon on it. Sometimes that makes you feel good as well. Now, when should one get professional help? If you feel your depression is getting worse and worse, seek professional help. Needing additional help doesn't mean that you're weak. Sometimes the negative thinking in depression can make you feel like you're a lost cause. But depression can be treated by a number of different methods, and you can feel better. Don't forget the self-help tips, and even if you're receiving professional help, these tips can become part of your treatment plan, speeding your recovery and preventing the depression from returning or just making you feel better every day. So, get those social groups. And again, that's sometimes hard right now. And I don't like talking on the phone or uh, chatting or whatever. And sometimes that's difficult. So for example, my 2 best friends in the world and I got together for lunch yesterday. We ordered lunch in and just went somewhere and had lunch together. Get active. And again, sometimes that's hard. Having a dog is sometimes good because sometimes you got to go out and walk the dog. Eating a healthy, well-balanced diet. And again, sometimes that cheeseburger is just fine. And I love the grumpy cat. I had a positive attitude once, and it was horrible. And I hope you can also see that one of my coping mechanisms is humor. Now, I want to say some words about suicide. Suicide victims are not weak, selfish, or cowards. They are fathers, mothers, sons, daughters, and you can read the rest of the list. Choose your words carefully and please don't judge what you cannot possibly understand. There are some suicide statistics. If you click here in the PowerPoint, you should be able to see those. But I just wanted to put up the stats of the state of Missouri. This was from 2017, and these were the 10 leading causes of deaths in Missouri. And you'll notice that suicide was number 10 on the list. Missouri actually has a fairly high rate of suicide. We rank 18th in the United States in deaths from suicide. This is somewhat humbling, and I'm not sure exactly why this is, but some have said especially that suicides in the southwestern part of Missouri are fairly high, simply because we have a good Scotch-Irish background that we always want to bring ourselves up by our own bootstraps. And again, sometimes that's not good. We need to seek those social connections. Now, Suicide warning signs. There are a number of them, and not every one of these means someone is suicidal, but sometimes if you put several of them together, it could mean that. A sense of hopelessness for the future, isolation or feeling alone, being aggressive or irritable, possessing lethal means, feeling like a burden to others, drastic changes in moods or behavior, talking frequently about death or self-harm, such as in cutting behaviors, engaging in risky behaviors, making funeral arrangements. That doesn't always mean by itself someone is suicidal. Giving things away, substance abuse, self-medicating, making suicide threats, having a negative view of self. If you see one or more of these signs, it may be the fact that someone is considering this. That doesn't necessarily mean that they will go through with it, but it's a possibility. Sometimes we see a change in the individual where they, once they make a decision, are much better. And sometimes that can be a major shift in their mood or behavior. And so we light a candle to remember those lost to suicide. In my first 10 years out of vet school in southwest Missouri and in surrounding areas here, we lost 10 veterinarians to suicide in those 10 years. Veterinarians have one of the highest suicide rates of any profession in the U.S. And that's a sobering fact, and our veterinary community have actually looked at that. At OTC, we have actually lost 4 people to suicides since I've been at OTC. It's somewhat a sobering fact. So what can you do if you think someone might be suicidal? Ask the person directly if they are thinking about suicide or hurting themselves. Asking them does not put the idea in their head. Take the person seriously. Listen without judging. Comments like, "Well, you're fine," don't help someone that's considering suicide. Offer to go with the person to a counseling center. Tell someone. Get help. Provide the National Suicide Prevention Hotline, and I've listed it here. If a person is having active suicidal thoughts, do not, under any circumstances, leave them alone. And if you think that someone is having an issue on campus, call either campus security or at any time dial 911 to get some professional help. And so there's a lot of reasons that I stay. And I'll be honest, I've had suicidal ideations in the past when I've had severe depressive moods. I'm not at this point that bad, but here's one of the reasons that I stay. And this is Bella. Now, she's not the only reason, but she's one of the big reasons that I stay. And it's one of the reasons why I have a dog, is because she needs me. And that's a good reason to stay. So, in the face of the humor that I use, here's our zebra losing the stripes. I think it's stress. And certainly there have been days I feel like that. But here's the one I really like, the fish in the blender. And you thought there was stress in your life because the blender's plugged in and all it would take is one push of the button. If you would like to talk with me, discuss anything with me, please feel free to do that. And I'm going to say this. I am now done with the narrated PowerPoints, and I feel fantastic that it's finished. So have a great day. Seek social interaction even during this time of social distancing, even if it is electronic, and be well. Thanks.